In your health tonight, we're going to talk a little bit about plastic surgery. A sluggish economy certainly isn't stopping the booming business of anti-aging. Last year, Americans spent more than $10 billion on cosmetic procedures. And to explain why more people are going under the knife to look good is our resident Dr. Mitchel Goldman from UCSD. Always a pleasure to see you today.
Good to see you, Jen.
All right, so let's talk plastic surgery. It's the 10-year anniversary of Botox.
Yes.
So talk to me a little bit about how the industry has changed in the last decade.
Well, over the last 10 years, people have been doing more non-invasive procedures. We still know that the invasive procedures, the most common ones are things like liposuction. I like to call it liposculpture because it's a very simple procedure, can be done literally in an hour or so, and you can be back to work a few days later. But what the non-invasive procedures are doing, like the Botox, Dysport, and the fillers, are you're able to actually rejuvenate yourself in a matter of minutes with no downtime.
Talk to me about some of the other, I mean, you mentioned liposuction, but the other procedures that people are going under the knife for that you're seeing more common.
Well, especially here in California, it's breast augmentation. Not for men, but for women. But that would be the second most common procedure. Things like hair transplants are still pretty common. Tummy tucks, especially for women that have had a number of pregnancies, are common. Eyelid surgeries, and of course facelifting. But it's the non-invasive procedures that are really growing even more, like the Botox and Dysport, like the Restylane and Juvederm and Radius and Sculptra, which are the fillers, and also laser procedures. The most common laser procedure is something called the intense pulse light. And the more we do these procedures, the more we know that they don't just make you look prettier by getting rid of fine lines, wrinkles, red marks, and brown marks, but they also help to prevent the development of skin cancer. So here in San Diego, the intense pulse light is a very popular procedure.
Wow, and I would assume in the last, 10 years or so, there's been more science also done, because I know a concern for a lot of people is the safety aspect of both surgical and non-invasive procedures.
Well, the safety is a concern, but fortunately, all of the procedures are very safe. Liposculpture or liposuction is now done entirely under a local anesthesia with awake patients. So that's how patients can literally get up from the table, have a nicer looking body, and go back to work 3 to 4 days later.
All right, so talk to me, doctor, about the ages that you're seeing. You would sort of think, some of these procedures would affect typically older people, but you're seeing some younger people doing them too.
Yes, it's not just the baby boomers. Although the baby boomers make up 78 million people, so the largest part of our cosmetic population, it's Generation X. It's the people between the ages of 35 and 45. They actually are really increasing in cosmetic procedures. And the reason is they want to try to prevent the wrinkles from occurring by doing things like Botox and Dysport in the frown lines and the forehead. So the key thing now is prevention. You want to prevent having to do a facelift, prevent having to do surgical procedures, and that's by doing these very simple, almost painless, non-invasive procedures.
Right, and are you seeing similarities between men and women in the sense of what they're choosing to have done?
They really are. The most common procedures for men, besides hair transplants, are liposuction, and I even had it done as well.
You did?
Yeah, because the thing is, as soon as you hit like
I would not think that.
Well, I know, but I won't take off my shirt. Well, unless it was sweeps week, and then maybe we'll do it. But,
okay, next month.
But the thing is, you want to get rid of those love handles after a while, and those are very popular procedures with men. Also Botox, because you don't want to always look so mean. And then finally fillers, and those are the popular procedures that men have.
And have you had those done too?
No, just the liposuction.
You don't need those.
But we did talk about things for treating skin cancer and early skin cancers, like photodynamic therapy with the intense pulse light. I've actually had that done too, because I actually had a skin cancer over here, and you can't see any scar now.
Can't see it at all. All right, Dr. Mitchel Goldman, thank you so much for your time, as always. Let's send it over to Lauren, who absolutely needs no work done, Lauren.
Certified by a doctor.
That's right.
Dr. G, we'll talk.